Good morning, everyone. Welcome to the Health Breakout panel for today's conference. My name is Earl Louie. I'm the Program Director at the California Wellness Foundation. I manage our equity and access portfolio, which includes our healthcare-related grant making and immigration-related grant making. So we're here today to explore the health impacts from the COVID-19 pandemic on immigrant communities in Los Angeles. I'm sure everyone here knows, and I'm going to state the obvious, that the pandemic exposed and made worse the health inequities that immigrant communities face every day. So to explore these issues and to help us think about what we need to do now to rebuild, to build back better for immigrant health, we have a wonderful panel, and I'll introduce our panel briefly. You can read their full bios on the platform. But first, let me introduce the panel. We have Senait Admassu, President of the African Communities Public Health Coalition, Mayra Alvarez, President of the Children's Partnership, and Robert Contreras, President and CEO of Bienestar Human Services. So the format for today's session is that I'll ask some questions of our panel, and we'll have a conversation for about 20 minutes. And then after that, we will take questions from the audience for about another 20 minutes. At any time, you can place your questions in the chat, and we will sort through them and try to get through as many of them as we can. So we're going to get started now, and my first question will be for Mayra. Mayra, statistically, children have not been as hard or are not as hard hit by COVID-19 as adults. However, like COVID-19 trends in adults, certain populations of children are disproportionately affected, and the pandemic is impacting child well-being in multiple ways. Can you talk to us now about how children are faring and what health issues need to be addressed?
Absolutely. Thanks, Earl, and thank you for the opportunity to join today's panel discussion and conversation on how we can support immigrants as we recover from the pandemic. So I think you hit the nail on the head as far as the impacts of the pandemic on children happening in multiple ways. So while yes, the statistics of COVID cases amongst kids are not as stark as they are in adults, they are hitting children, and disproportionately they're hitting children of color and children in immigrant families. And what we know is true is, like immigrants across the state of California, they are on the front lines of today's economy in the work that they do every day and the services that they provide for our communities. And as a result of that, they are therefore more exposed to COVID. And when parents are exposed, when family members are exposed, they bring that home. And that is what is happening with many of our kids at no fault of their own, of their families at all. But it's the reality that it's the devastating consequences of the pandemic are happening on those that are shouldering our frontline work and allowing those of us that have the privilege of working from home to be able to do that. And I think for kids in particular, you have to consider the impacts of the pandemic from a whole child perspective. So really thinking about the direct health impacts, how many children are actually contracting COVID-19. I think in California, roughly 500,000 children have contracted COVID-19 between the ages of 0 and 18. So we know there is a number of children in a state as large as ours. But it's not just the direct health impacts of the pandemic, but also the indirect health impacts. So one of the things that we know is happening is that there are a number of immigrants, of members of our immigrant communities that are dying as a result of COVID-19 because they're disproportionately impacted, again, to the pandemic because of the work that they do every day in and day out. And that has consequences for children. When our immigrant family members are dying, that means parents are dying. That means older brothers and sisters and aunts and uncles are dying, and that we are dealing with this huge onset of grief in our children. And thinking about child well-being and the opportunity to support that well-being, you have to consider the impacts of grief on our kids and the disproportionate impact again, on immigrant children, on children of color, and how we can support that. So again, thinking about what recovery looks like, what building back better looks like, considering the mental health impacts of this pandemic has to be front and center. And it's not only grief of losing family members, but also the grief of losing time with friends, losing time in school, losing the opportunity to do many of the events that children and youth experience in their normal day-to-day lives. Those are all processes that have to be responded to with grief counseling, with trauma-informed supports and services, and have to be integrated into whatever recovery effort we try to do. But in addition to that, as we consider the challenges that are imposed on families, it's also economic impacts, housing impacts, nutrition impacts that have, again, a connection to child well-being. So when families aren't able to work as much, that has implications on the access to food, access to nutritious food for children. Same with housing assistance, and then the opportunities to provide new ways to support families with housing supports as we recover. So it really is a multiple impacts on children that need to be considered. And given what we know about brain science and childhood development, these aren't quick fixes. These are investments and opportunities that we need to consider for the long haul when it comes to the well-being of these kids. So recovery isn't going to happen in 6 months or a year, but really considering over the next 5, 10, even more years, how can we continue to invest in the well-being of our kids, ensure that the community spaces that they're in, that they are supported, and that child well-being is front and center.
Great, Mayra. Thanks for focusing so much on kids. We're going to turn, my second question will be for Senait. Senait, what have you seen as the main impacts on refugees of the COVID-19 pandemic, structural racism, and the previous administration's asylum and immigration policies?
Thank you again. I guess you asked me 2 questions together. So if I had to focus first at how does it impact the COVID-19, it is greatly impacted the immigrant and refugee communities impacted by COVID-19 because it's overlooked the status of the immigrant health. That's because as an immigrant, not only we worried about our status and the lifestyle, we also worried about the family we left behind back home. And that's one issue. Another one is the social distancing is devastating for the immigrant refugee communities because immigrant and refugee community depend on the spiritual community and the social and the spiritual community as a source of resilience, so strength. So losing that is devastating and impacting our inner strength, per se. For example, during this pandemic, we received several calls from the community that is really related to the immigration status, also lead to mental health issue. We have domestic violence issue, we have abandonment, family abandonment, in other words, like this social or financial strain, and people just walk away from the family. There is substance abuse issue because of the immigrant and refugee we serve. They're not comfortable. They don't have trust to go have access to receive services. These people have culturally and linguistically barrier to go find services, and that's the main issue. So communities in crisis, and then as COVID virus spread all over US, and there must not be one size of lens and to see how COVID impacted the community. It has to be addressed, the psychosocial issue has to be addressed from cultural perspective, and that's what we're missing during this pandemic. If I had to touch up the immigration issue, yes, the immigration issue being, being really impacted mainly. Immigration refugee face the structural racism. What does that mean? We had a system that treats immigrants and refugees differently on their color of skin or their ethnicity. And so that's systemic structure, racism. So how does it impact us? The last political systemic racism, I think a lot of presenters covered yesterday, but just to touch up, for example, the examining immigration policy the last time, you know, through the systemic racism lens showed that today, largely undocumented immigrants during this pandemic was unable to have any kind of coverage versus past years. In a way, a decade ago, there's a lot of white immigrants who are unlawful, came in the same way. They've never been impacted by any of policy. In other words, like not only the undocumented during this era, afraid to be deported, separated from the family, but also, you know, be able to support during this pandemic situation because of the immigration policy, what we had in the past. If they lose it, as I say, during this pandemic, a lot of people are afraid come forward to identify themselves as undocumented, although they are taxpayers and somewhat, that's the kind of structural racism has impacted our immigrant refugee community. So what do we need to do? Like, given the disproportionate impact of the pandemic, immigrant refugee community, we will need to step up and urge a decision maker to support an effort to meet the needs of immigrant refugee, to support the population regarding immigration status. We need to be inclusive in the budget of the decision maker. That's what we need to do. But I'll come back to other issue toward this later on if there's any question.
Great, thank you, Senait. Robert, Bienestar has a long history of serving LGBTQ, Latino, and immigrant communities in LA. What have the past 16 months been like for the population that you serve?
Thank you, Earl. Well, the 16 months have had been a little bit different. They have affected a little bit different our LGBTQ plus immigrant population than the community at large, or even the Latino community at large. In terms of the programs, policies that were passed in order to help those populations didn't quite have the intended effect on the LGBTQ immigrant population. For example, policies such as stay at home did not quite work for these populations because the work that these individuals do cannot be done from home. So many were either laid off or fired, forcing some individuals to venture out and put themselves at risk of COVID-19 in order to make ends meet. In terms of specific population, for example, young LGBT individuals were forced to stay in small apartments in a family environment where their sexual orientation or identity was not supported, or and without the ability to leave, created a toxic environment where all the family frustrations was laid out on them, that some opted to leave the house or apartment and rather be homeless than remain in such a toxic environment. Transgender populations, specifically transgender women, some did not have steady jobs and many did not qualify for benefits. When they lost their jobs, some were forced to engage in survival sex. Many reported to us that because demand for sex was low, they had to increase the number of sex encounters to make ends meet. In terms of gay and lesbian individuals, an already isolated population, because they are either without family or their family have rejected them, were cut off from their networks and social lives, that many became extremely depressed. The number of calls that we receive for mental health services increased 100%. Many of them tried to access these services by other means, but most were unable to get Spanish speaking counselors, so they were left to their own to find assistance they needed. In terms of unemployment and supplemental benefits, these benefits did not reach most of our clients since they work in the underground economy. So when they were laid off or terminated, they were unable to collect unemployment. Rental assistance programs, some opted not to apply for rental assistance or mortgage assistance programs because of fear of not being able to normalize their status or become citizens. The American Rescue Plan did not work for our population either, for the same reasons that the rental assistance programs. They feared that this would be considered public charge, and the undocumented individuals didn't qualify anyway. So some were even hesitant to actually apply for the California fund that was set up to assist undocumented citizens, because of the same thing that they felt that this may end up being considered public charge. So Bienestar responded to this crisis by implementing telehealth services to provide mental health services, substance abuse treatment, support groups, housing and rental assistance, education. And we expanded our food bank for our clients and non-clients. We also, as the progression of the pandemic went on, we added COVID-19 testing, and currently we are doing COVID-19 vaccination. So we need to make sure that whenever a national crisis of this magnitude hits the country, in the future, we need to make sure that we press the federal government to respond with programs and plans that would cover everyone in the nation, not just those individuals who are here, who are citizens or have a legal status, because everyone is a human being, and basically they are all facing the same trials and tribulations as an American. So we need to make sure that future responses cover all individuals, not just some.
Great, thank you, Robert. Before I go on to the next question, I just want to remind our audience that you can post any questions that you have for our panel in the chat. So please don't be shy and place your questions there. So you have all lifted up a lot of issues, and one of the common threads, I think, through everything that that the panel has talked about so far is mental health. So let's turn to how what policies or changes that you all see or that you all need to see to really help improve the health of immigrant communities. So what kind of changes down the road are needed to address a lot of the issues that you've identified? So I'm just going to throw that open to anyone who wants to go first.
I can go. So as I said earlier, during this pandemic, a lot of factors for immigrant refugee lead to the becoming mental health issue within the family and beyond. So one of the things we have to advocate, we've been working actually with MHSA, Mental Health Service Act, and Oversight Accountability Commission. We have few immigrant-driven organizations being appointed to be part of it, and African Coalition is one. One of the things we're working closely is that it has to be a way to address the issue of, from a cultural perspective, mental health. How do we treat mental health from a cultural perspective? Because there's a Western medicine that is commonly used as a traditional way, but does it really approach the way we accustom and we get used to it? Is it really inclusive of our way of healing system? That's what we're working on. So what do we need to do? One is we have to shift the way we deal with as a human service in different level versus applying the traditional way treatment. Second, we encourage the decision makers to bring more treatment that applies to such ethnic population. And the second is more allocation for community-based organization that has hands-on in the community, which provided cultural and linguistically appropriate services. So in general, the immigrant refugee communities has to have a representative with the decision makers to discuss, to bring the voice of the community they serve. And that's one way of addressing the mental health, because pandemics mainly intensify the mental health already existed in the immigrant community. This is not only for immigrant, because pre and post migration is a really big immigrant mental health issue. I will stop here.
Great, thank you, Senait. Robert or Mayra?
Yes, in terms of that, I would just like to add that in terms of funders, either government or foundation funding for mental health, that some of the restrictions that are placed on programs to provide mental health to individuals, some of the restrictions should be lifted because some of these programs prohibit you to provide services to those who are undocumented. So then those individuals who most need the mental health treatment do not have access to it and are then dependent on receiving the mental health needs that they or services that they need from friends who are not qualified. And also make a concerted effort to empower individuals from the communities that speak the language of the person seeking the services, because most often, as I mentioned earlier, individuals try to access mental health services, but they can't because of the language barrier. And it seems more and more that we are losing the capacity to provide mental health services in the language of those individuals that need it the most, especially in the immigrant community. So I think that we need to remove the restrictions that we have in terms of citizenship or legal status, but at the same time encourage individuals to speak those languages to go into the field, because it's a much needed service that is not being provided.
And I think, building on what both Senait and Robert have said, in considering mental health supports and services, really considering a bigger picture perspective of how we support overall well-being of children and families, recognizing that economic security is a mental health intervention. Housing assistance is a mental health intervention. Like the fact that many families are stressing out over being able to pay their bills, take care of their kids, feed their children, only exacerbates mental health concerns. So thinking through this holistic perspective will enable us to better support our immigrant families and communities' overall success. And I think that then speaks to many of the policies that we want to see more inclusive of our undocumented family members, our immigrant family members, particularly knowing that the federal investments that we've seen have not been as inclusive as we need them to be, particularly for a state as diverse as California. So obviously many advocates across the state are pushing health for all and ensuring that the security of health insurance coverage is available to everybody who calls California home. In particular, during this pandemic, health and health status is particularly important. We want to make sure that the fear of what it's going to cost someone or where they're going to go to a doctor is alleviated by having that security that comes with health insurance coverage. But in addition to that, there are programs like our California Food Assistance Program that can be opened up to more immigrant community members that then would create what we know in child advocacy as known as the welcome mat. Children are more likely to be insured in health insurance coverage, are more likely to be covered by services when their parents are covered. When we can consider these issues, these programs from a family perspective, it's a good thing for kids. So if we open more food assistance programs for immigrant parents, we're going to see those positive impacts on child well-being because it's whole family approaches. And I think that's what we're seeing with the investments that the Newsom administration put in his May revision, that the legislature has proposed, and some of the proposals that we've seen from them. There is this general understanding and commitment to ensuring that everyone that calls California home has access to the supports and services that they need to recover from this pandemic and not survive, but to thrive as we move forward in the future. And keeping in mind this holistic continuum of services that families need will not only help the immediate needs of families, but also the long-term well-being, given the mental health implications that may not show up until later on in life.
Great, Mayra, thanks. Just want to follow up on a couple of things. Mayra, you mentioned, the state budget. You mentioned, the funding available from the American Rescue Plan, and a lot of that's coming to the state, and a lot of that's coming to local governments, cities, and counties too. So, do you see any hope that funding will be well used? And this question's for everybody, not just Mayra, but do you see any opportunities there to use that funding to meet community needs?
Well, for me, as Mayra said, when she mentioned healthcare for all, right? That it has to be truly for all. The American Rescue Plan, while can do a lot great for the vast majority of the population, is leaving out the most vulnerable individuals. Those who for years or decades now have lived in the shadows because they have not been able to normalize their situation. So these are already marginalized people that are being left out of some of these benefits that they actually contribute, because most of them do contribute to by paying taxes, but they do not reap the benefit of any of the benefits that the governments have placed for the general population. So I think that those funds that would come to the state as part of the American Rescue Plan would benefit, but again, it's not going to be 100% benefit for all, because some individuals are going to be thrown to the wayside.
I can add a little bit about the mental health aspects of this. Mental health, I think LA County has 35% of immigrant refugee, if I'm not mistaken, the status, the data. So Mental Health Act, I don't know how many of you guys know, MHSA's Mental Health Act, Mental Health Service Act, I'm sorry. That is implemented 2005. That's a taxpayer's money specific with the mental health, right? So what we're trying to do is, as I said earlier, we make sure the people heard and not dismiss the concern. If the concern is mental health for all, yes, it has to be. That money is for the taxpayer. What does it take is our voice. Our voice means we have to be a decision maker, part of that decision maker, whether a local level or a state and a county. This is our voice, and this is what we have to address, what is going on. We really have to meet in between the decision maker and the community at large. Mainly our board of supervisors really had to take in consideration right now, during this pandemic, the mental health issue is really affecting most immigrant refugee, but as whole in the society, more so immigrant because of the status, and also so many other factors. So we're trying to locate that money and equity distribution of the money to anyone, despite the race and the color or that's what the kind of advocacy we need to do to see there's an equity and budget allocation and also fairness within that. What does it take? It's our voice and advocacy work to work with our board of supervisors, local counties, and also states. So that's what I'm just going to say that about mental health, because it needs a lot of advocacy, as I said earlier, because the traditional way of doing things, it is good, but also we have to expand and empower our decision maker. What does it take to address the community at large issues?
Thanks, Senait. Mayra, did you want to add anything more on funding or policy or?
Yeah, I'll just say that to your question, Earl, I'm absolutely hopeful. I think the investments that we've already seen, and again, in the May revision, in the legislature's proposal, are incredibly indicative of a commitment to all Californians. And I think it's important to consider, while yes, these are one-time investments, they are going to be over the next few years. And what is so powerful about policy change, and once people have access to services, it's very difficult to take them away. And given the work of community organizers and advocates and leaders across the state, it's building up the capacity of our immigrant communities, and that has already been built up over the last few decades, and thinking about the incredible wins that the immigrant community has made for themselves, that advocacy will continue as we continue to push California in the direction of being more immigrant inclusive. So that in and of itself gives me so much hope for what we could potentially do in this recovery and over the long haul.
Great, thanks, Mayra. So we have a question from the audience for our panel. And again, audience members, please keep those questions coming in the chat. So the question is, how do you respond to immigrant families who feel that they are unable to receive free and or low-cost mental health services unless they have involvement with DCFS and or DPSS? So who'd like to take that one on?
Can you repeat the question one more time?
Sure.
Yeah.
Sure. How do you respond to immigrant families who feel that they are unable to receive free and or low-cost mental health services unless they have involvement with DCFS and or DPSS?
I think this question, the person who's asking this question might not be, this is one way of raising awareness. Mental health, actually, there is free. You don't need to be engaged or involved with DCFS or DPSS. DCFS is, for example, Department of Children's Services Family. That's mandatory if you have to get involved. But however, there's a lot of organizations that provides free mental health service. You don't have to be engaged, you don't have to belong to any of the entities. We just find out where you need to get help, whether you're the geographical area where we live, or just Google anywhere. I think there's one opportunity this time that mental health will be provided for, whether documented and undocumented. So if you need more information, you can contact us. We can provide you information.
I think one thing, just this, and I obviously, Senait is directly in the community and leading, so much of this work. But, to the question from the audience, it's important to Senait's earlier point, why we need to integrate community organizations into our mental health delivery system, right? That it's not just traditional county providers or traditional healthcare system entities that are needing to respond to the needs of immigrant communities, and that it's the leadership of local community organizations that actually serves as that critical bridge to accessing services and can help that happen, right? And we see this in other investments that the state made. When the administration created the Disaster Relief Assistance for Immigrants Fund, they utilized the power of community organizations in order to distribute those resources. And that enabled immigrants to have trust, to have connections, to be able to move that money faster out the door during a critical time period. If we keep that same sense of urgency on an issue such as mental health, we can continue to utilize, again, the leadership and power, the trust that community organizations have in order to better meet the needs of immigrant families.
Thanks, Mayra. Robert, did you want to weigh in on that question?
Yes, in terms of that, I think that Mayra had said it best. We need to involve community-based organizations, and whenever we are dealing with mental health, the program should not be very prescriptive in a sense that most require you to have only a certain amount of sessions that you can have with the individual. Some say it's only 5, some say it's 3. So we need to make sure that the programs are developed to address the actual issue that the individuals are facing. For example, in the LGBTQ community, you have so deeply rooted traumas that cannot be dealt within just 1 or 2 sessions. It's a process you have to engage. So basically, we need to develop those programs that are geared to addressing the actual root problem and not just meeting a certain number of sessions, because we know that those don't help. And if we do not address the root trauma that's that has created on the individuals, such as coming out process, or the trauma that they face in their country for being members of the LGBTQ population community, we need to make sure that those programs are designed to address deep-rooted traumas that the community is facing, and again, have culturally sensitive individuals that understand where these people are coming from, and that they know what it is to have suffered that trauma, and be culturally sensitive.
Great, thanks, Robert. So we have another question from Yosef. Each community is different, and it's important to recognize that. But in your experience, what are the best practices for destigmatizing mental health for immigrant communities? Destigmatizing mental health for immigrant communities. So who'd like to start off on answering that question?
I would start. When talking to individuals about mental health, especially those who have not been exposed to what actually mental health is, it's very important to communicate the benefits of it. That it's not necessarily to treat a mental disease or to stigmatize it by giving you a label that you are crazy, but actually using techniques of motivational interviewing for you to have a conversation with those individuals, so they can actually come to the decision, so they can make the decision about the benefits of it. And then also in terms of community engagement, having promotional campaigns, also championing the benefits of mental health services, because most individuals do not know what it is. They think that if you actually are talking to someone about your problem, that those conversations may be heard by someone else. They do not understand about what HIPAA law is, or that is just something that we have to have between just you and your counselor. So there's a lot of things that we can do, but actually it's trying to get to the community, explain what it is, and try to destigmatize the mental health services, and just make it available to everyone. I think especially those individuals, as you said, especially immigrants, because all immigrants coming on their journey to this country have at one point or another suffer some trauma that they may need some mental health counseling to resolve.
Thanks, Robert. Senait or Mayra, do you want to jump in on answering that question of destigmatizing mental health for immigrant communities?
So as I said earlier, there's must not be one size fits all approach to address the mental health issue in immigrant community. Within each context, it's necessary to understand how mental health affected within that group. So to reduce the stigma is all, not only this time the mental health, and also the vaccine itself has been a stigma. I mean, the mistrust of vaccine in our community is our concern. So how do we do it? As I said, it has to work from cultural perspective. We have to approach on engagement the community leaders that will know the community, can speak the language, and then normalize what mental health means from cultural perspective. Normalize in a way means those stigma, whatever is interpreted within that culture, has to be stigmatized, to normalize that it's okay to be mental health. So raising awareness is one way. Second way is it has to be a different approach within the context of that population. As we said earlier, there's no one way to approach mental health, and that's what we're trying to change, and that's why we need a lot of advocacy, that we have to speak as immigrant refugee representative how we would like to be treated, and what does it take the community to empower and reduce the stigma. So best way is raising awareness, a lot of education, and also working with the decision maker so they can understand what is the outcome it looks like from a cultural perspective. Thank you.
Great, thanks, Senait. Oh,
And
Mayra?
yeah, I'll just add, Earl, I think there's an opportunity here for all of us really to contribute to this destigmatization or just more acceptance of mental health. And I think the pandemic has made that all the more possible, right? The idea of social isolation and how it's impacted us across, backgrounds, immigration statuses, economic statuses. It's real, and it shows up differently for so many of us, right? But particularly for immigrant communities who, research tells us are closer to their families, are closer to social networks. That has been a challenge, and even in and of itself, right? The physical distancing requirements and things like that, whether they're able to actually abide by them or not. But the idea that that's supposed to be something we're doing now is incredibly challenging and impacting our mental health. And so talking about that with our circles of friends, with our family members, with the people we serve, helps normalize this conversation. And this is particularly important when it comes to our kids, because mental health concerns and impacts will show up differently in children. It could show up as aggressive behavior. It could show up as retreating or crying a lot or not being hungry anymore. And really thinking through how parents, they themselves have the tools and resources to support their child's well-being is critical. And knowing that that conversation, that space that we can create to talk about our mental health and how we're feeling, in and of itself can lead us in that direction of destigmatization. I'm not saying it's the end-all solution, but it is an opportunity that all of us have a role to play when it comes to really, moving in that direction as a society.
Thanks for that, Mayra. I just want to point out for the audience that in the chat, there are a number of helpful resources posted that people might want to explore. The Health for All Coalition, CalHope as a resource for providing emotional support, mental health support for folks. So please check those out if you're not aware of those. So our next question, I think, the last question, I think, is a nice segue to the next question, which is from someone who says, as a CBO, we want to initiate and add much needed mental health services to serve the community that we serve. What are the recommendations on where to start? Okay, we've stumped the panel. I know that's a little question, right? Who wants to take that one on? Where to start?
I'll take that's my experience. If I share my experience, and before becoming mental health service providers, we were just community advocate group. What we did was we just be the agent to listen. What's going on in the community. That's why we start. Be the agent to listen and to respect and advocate before to have the actual mental health service. Because there's a process has to become a mental health service, but it started from the community, from individual to mental health service. We don't have to be licensed. We don't have to be certified to mental health service. Mental health service is like someone can listen and just guide it to where that someone can get help. And that's why it starts as an individual. As a group and a CBO, of course, we have to follow, like we're really proactive advocate and listen to the community. And what we have to do the outreach, really intensive outreach to bring the community's issue and address the entity. Department of Mental Health is one, or the state level, even networking with CBOs that does mental health service. That's how it started. So in general, I want to say that it takes a village. In other words, you have to start from the organization to be an ear and just a listener to someone before we come into mental health service. And we can follow the steps working with Department of Mental Health, if that helps.
Great. Okay, so if I can sum up, talk to Senait if you are interested.
Yes.
Mayra or Robert, yes, go ahead.
Oh, well, I also would like to say that creating a partnership with colleges who have mental health students, Master of Social Health, to come and be interns. All you have to do is make sure that you can provide some supervision, and that supervision can be done through an LCSW that can provide the supervision for them, and the LCSW could be a consultant. But that way you can structure a program that can help individuals with trained professionals that are not licensed, but do have the qualifications and the ability to help individuals who need mental health. And that, I believe, would be a relatively inexpensive way to start a program providing mental health services. But it's about contacting colleges, and we're fortunate enough here in Southern California, Los Angeles, that we have so many colleges that are providing providing these services or having this class for students to become MSWs, and those individuals can help those in most need. And again, it'd be relatively inexpensive, and for any organization to start those programs.
Great, thanks, Robert. Mayra, did you want to weigh in?
I will defer to our direct service leaders.
Okay. Robert, have you done that? Have you worked with college students then to provide services at Bienestar?
Yes, we actually have. Again, since we deal with the immigrant population, we have a lot of our funded programs that do not allow us to provide mental health services to undocumented. So the way that we have bypassed that, when we started, it was basically like that, having a consultant LCSW provide the supervision for the MSW individuals. And as we've been in the community, by the way, for 30 years. So as we have grown, we have developed relationships with UCLA, USC, Cal State LA, Cal State Northridge, and the Pomona colleges, where we basically talk to the faculty there that are part of this MSW programs, and then they actually help place these individuals with us, so we can actually provide those services. And it's been beneficial because these individuals stay with us for 6 months most of the time, and it's always good to mention that some individuals actually stay and become actually employees of the agency. And by being with us, they get the supervision and the number of hours that they need to eventually become LCSWs. So that's to me, that's the best way to start it, because yes, you have to pay for the supervision, but it's only a couple of hours per month that you need to provide. And some of these programs allow you to do group supervision. So that also cut on the cost, but the benefit that you're reaping is providing the much needed mental health program to the community, especially for those individuals that maybe your programs do not allow to join through the specific funding. So yeah, so I said those are the best ways.
Okay, great.
Go
ahead.
I
Yes.
see in the chat something, the really good point, promotoras. I think mental health also, that's where we started anyways. Promotoras kind of outreaching and an engagement kind of project within a community that doesn't have to get direct service in mental health therapy. That will also give a mental health service in a way, education and outreaching. If someone make a comment, it's wonderful tools so you can establish that program, outreach and education. It's about promotoras that training the community leaders, the community lay people, just go help the community. So that's one way to start the mental health service. In addition to what Robert said, just for the direct service, having therapy and assessment, that it would take more clinician, licensed clinician to build the program.
Great, thanks for those thorough answers. And as the audience can see, both Senait and Robert can be resources for folks who would like to start offering mental health services. So we have just a few more minutes. I just want to give panelists just maybe 30 seconds to a minute at most. We got to keep it brief, but just maybe we could end by if you could just say something that gives you hope for the future, for the health of immigrant communities. Just what is something that gives you some hope for things getting better?
I think I can start in building off of the previous conversation. the fact that we have organizations that are asking, how can we integrate mental health services into our care delivery, into our services for our immigrant community members, really speaks to the heart and soul that so many of our community organizations, so many of our immigrant leaders are putting into the work day in and day out, and recognizes the power of our community to meet the needs of our immigrant families. And that gives me hope. A recognition that we're moving in that direction, giving more voice and credibility to the leadership of our immigrant families, and recognizing that we can make these investments and really bend our moral arc towards justice, and lead the way in California to demonstrate for the country, what we want to do for our immigrant communities overall.
Great. Senait or Robert?
For me, just to go back to that, the systemic structured racism, we've seen in the past 4 years and how it impacted from the top down due to the immigration issue that trickle down for all the how we receive a service, who we are, identify ourselves, what we belong to. That's why we're reminded all the time, division. So my hope is like the new administration, Biden administration, will help to reverse that social or racial inequity, give us more chance to integrate it in the equal way and be able to achieve our goals as immigrant refugee. And also emphasize what we contribute to the community or the society at large, but not to be seen a burden of the society. So hopefully Biden will implement that policy to see the better way. Thanks.
Great. Robert, you have the last word.
Well, what can I say? I think that Senait and Mayra have summarized it very well. I think that just by the sheer number of people on this workshop, gives me hope that that we can come together and make change in the lives of those individuals here, recent immigrants or immigrants as a whole. And to also include, not forget the LGBTQ community in there, because sometimes it is forgotten, and they do need the services as much as anybody else. And yes, and hopefully we can push the Biden administration to take more deliberate stand to create policies that benefit immigrants of this country, because they do contribute to the economy, and they do not, especially those who are not documented, do not benefit from the programs to which they contribute. So I am hopeful, but let's remember that we still have a lot of work to do in order to make sure that everyone has equitable amount of a chance to access the services that this great country can provide for their citizens.
Robert, thank you for that. So the panel has hope, but there's a lot of work to do, and I think that's a great way to end this panel. So please join me in thanking our panel virtually, and thank you to all audience members who contributed in the chat, questions and resources. So it's time for a break, a short break, about 12 minutes to 10:15, and please come back at 10:15 because you won't want to miss the next session, which is a plenary session on unaccompanied children, migrant children arriving. So be back at 10:15. Thanks again for participating in the health breakout session.